Last week, Andrew Huberman tweeted out a seemingly simple list of what he considers the top 8 pillars of mental and physical health. Honestly, most of it's pretty basic: sunlight, exercise, nutrients, gets a little optimizing there, but if we think about it as a balanced diet, totally makes sense. Number 8 is interesting, and there is some truth to it. Some people who believe in a god or have a spiritual practice feel better because they believe in that thing, which then has downstream health effects that benefit them. If believing in a god helps stave off depression, for example, that's a net positive for you. The problem happens if you start thinking that other people need to believe in your god, but that's a different story. And honestly, I appreciate that Huberman asked for additions and subtractions. Some people replied in the thread and he replied to them, but some people also posted something very relevant, and I noticed he didn't reply to that. And this is pretty common with wellness influencers and biohackers, often who are selling supplements and other services. They tend not to discuss the social determinants of health. In fact, I rarely see influencers discuss these because it's really kind of hard to sell to people when you're talking about what is probably the most important aspect of health overall. The social determinants of health, as defined by the U.S. Department of Health and Human Services, you have economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. So this is a big difference from wellness world, where you're supposed to avoid sunscreens and seed oils and then drink most of your nutrients. Out here in the real world, where racism and classism exist and people don't have access to education or employment or good health care, they might have trouble securing housing or staying there. These are way more important for individual and group health than anything you're going to find in the wellness industry. And that's why we call it an industry. I'm not trying to shame people who take powders or even who sell them, to be honest, but just don't pretend that those are the gateway to ultimate health when we have decades of data that prove otherwise. This is why on Conspirituality, we often talk about why wellness tracks right politically. Where they connect often is in this idea of individualism. And when you're so invested in individualism, you don't think about what collective health outcomes really entail. This is why the right wing often attacks DEI trainings and critical race theory. Anything that hints at the idea that you have to consider collective health is by definition evil to them. Because if the focus stays on the individual, well, then you can shame them and you can outcast them, and then you can sell to them. Addressing collective health takes systemic solutions. And if you haven't noticed, the right wing is spending a good amount of time deconstructing government right now. I'm not saying anyone who cares about wellness or any of these products and services are by default right wing. What I am saying is those magic juices and elixirs are not really what leads to good health for everyone. So stop pretending that it is. Try to be a little more holistic in your understanding and your marketing of what health entails. No single nutrient or protocol can deliver what social equity can. So the next time you're making an ultimate health list, just think about what we actually have data on, because it matters to everyone.